on prenatal care, on education, is not only the right thing to do morally, but it's huge amounts of money saved for the city down the line. Children who have received proper prenatal care have far fewer health concerns as they grow up. Certainly asthma has been linked to poor prenatal health care, and we have tremendous asthma problems in the city right now. I think that the city should be doing everything in its power. You know, when my wife and I had our first son, Wolf, it took a tremendous amount of advocacy on our parts to find the resources that we needed to make sure that we had the kind of birth and Kelly had the pregnancy that we wanted. And we came from a place where we thought we were fairly well informed. We came with a lot of education from a socioeconomic background, with a lot of resources available, and it was still very difficult. And I think that really highlights how far the city needs to come before we're really protecting women and children, particularly in that vulnerable early stage. So.
Yes, I would absolutely fund those programs. They're all critical needs of our community and of our city. Prenatal care, age-appropriate sex education, focusing on women's health, all the things that you mentioned, Lucy. But, you know, I do want to raise something, because we really haven't talked about health care. I think this is the first time at any of these forums. And it's something that, you know, everyone in this room should be aware of and should be doing and looking to for this year, which is that in the next 6-7 months, we have an opportunity to do something about providing universal health care in this country. And we all have to work, no matter who gets elected, we all have to work with our federal elected officials to make sure that we do something about the health care crisis. Because we now have 45 or 48 million people who are uninsured in this country. That's completely unacceptable. You go to Europe and you see, I mean, I'm sure many of you saw the movie, Michael Moore's movies, Sicko? Sicko, that's the name, Sicko. And it's a travesty that we still have uninsured people. I don't know what the number is in New York City, but we have to do something about that. And we have an opportunity now to take on that issue. And here on a local level, you know, there are things that we can do to provide more health insurance for people too. I know that Congressman Weiner has come out with a proposal last year for small businesses to band together to create a new pool where they can buy more affordable health insurance. Because at the rate we're going now, it's just completely unsustainable. And it is going to bring our economy down. If we think that we're in a tough time now, forget about it. We have to tackle this issue. It's of vital importance. So thank you for bringing it up.
Yeah, I 100% agree with both what Josh and Bob said. So there's not a lot of controversy, I think, on this particular issue. One thing I would add to that is it really is not only a moral issue, but a sensible budgeting issue. I mean, putting those resources into early childhood healthcare, and especially prenatal and education and testing, making all these things available to teenagers especially. I mean, people who are really vulnerable parties in society. I mean, so, you know, kids are you know, at the high school level are certainly, you know, worried about what their options are, and it's important that we make sure that the resources are there so that they can turn to somebody to ask questions and get the health care that they need, get the questions answered, so we have you know, a healthy baby, or you know, look at the other options that are available, be it adoption or abortion or what have you, for you know, for make sure, first of all, with education out there, that people are aware of basically, you know, what they can get themselves into as they're discovering their bodies in their teenage years. Speaking to the national issue, when I worked in banking, you know, I had customers that were in all manner of businesses, from, you know, law firms to accountants to engineering firms to you know, manufacturers, and the biggest wild card in anybody's expenses was healthcare. I mean, it's crazy that we still have a system that is based on, you know, your healthcare depends on where you work. So I think it's absolutely vital that we have a universal healthcare our single-payer healthcare with a public option. Everybody needs to be able to get, say, Medicare, and not just, we're going to have we shouldn't be stuck on having a private system. We should have a public option.
So my colleagues are absolutely right that this is a critical moment, and that even while we're out knocking doors and trying to persuade all of you and your neighbors to vote for us, that we need to find some time to be involved in national health care reform, because we've got to get it done this year. Of course, we need to invest more in prenatal and other early health care programs. One program in particular that the city runs that's really a gem, and I think part of the reason why Tom Frieden is now President Obama's CDC director, is the Nurse Family Partnerships program, which sends folks in both early and after, and is run by a Park Slope resident, and Senator Squadron actually was able to make sure that some of the stimulus money is going to go to growing that program, so that's one in particular that I'd like to invest in. A couple of issues in particular relevant to our neighborhood. First, Long Island College Hospital last year tried to close several of its clinics along with its OB and pediatric ward, and I was proud to work with other folks from Community Board 6 and in the neighborhood and on the Litch Community Advisory Board to stand up and say, absolutely not, we need to continue to provide those services, and the Department of Health agreed with us and is requiring Litch to stay open, to continue to have OB and pediatrics and a range of clinics in the neighborhood. We have 3 great hospitals with Litch, Maimonides, and Methodist in this district, and they can be better partners. And I think one of the things I'd like to do in the council is really reach out to them and figure out how we can deliver even improved health care in the neighborhood. And then finally, there's so many freelancers and independent workers in this community that we have to make sure that as part of health care reform, and obviously if we get the single payer or national health insurance plan that we need, they'll be covered. But I think I would try in particular also to pay attention to issues of freelancers and independent workers. We've got the Freelancers Union with the health insurance plan, but it's expensive, and obviously there's no employer match, so that's an issue that we need to pay attention to as well. Thanks, Lucy, for bringing up the issue.
Thank you.